All right, good evening. My name is Omari Salisbury, one half of the coronavirus update show. My colleague Nikki Barron is off for tonight, so we had to dig deep, like real deep, and find a co-host tonight. My man Bobby Stills. What's up, Bobby?
How's my hair look? This is my coronavirus update haircut.
Man, bro, you could keep that.
You don't like it? Well, I hope the viewers like it. So,
What?
yeah, I had to rush. I had to rush to the camera, man. I was like editing, and I was like, "Oh no, I didn't set an alarm." So
Yeah,
yeah.
well, lucky for you, the viewers always like you regardless. Me, I be the one struggling. I get wardrobe, this and that, haircuts. You just show up any kind of way with red hair everywhere, and it seems to always work out for you. How are you this evening?
I'm wonderful. I'm very happy to be co-hosting the coronavirus update show with you. I appreciate Nikki letting me sit in for her, and it's always a pleasure hosting with you. I'm excited to talk to Kevin Schofield. Yeah.
Yeah, so it's interesting. So we got Kevin Schofield coming up here in a bit. We'll hit the numbers first. But yeah, he was talking about a connection between the MMR vaccine, that's measles, mumps, rubella vaccine, and people's, I guess you would say, he'll have a better word for it, but infection levels maybe of people who get COVID. And so it's pretty
Yeah,
interesting.
it's a super interesting article. I read his article, very well written. I think it's interesting comparison according to the numbers. So I'm looking forward to hearing a little bit more about that and asking him a couple of questions. And I think it's imperative that the public knows some of this information. So I'm happy that we actually have this show and people like Kevin out there, writing about it.
Yeah, I gotta let you know before we get going though too. Is Nikki's home studio is much flyer than yours, bro.
I haven't had a chance to set it up, man. I got a little Buddha statue back here. I got to hang some art. I don't know, man. I haven't set anything up. I borrowed a ring light from the studio. I do have my microphone though that I've had here in the studio. You
Yeah,
know what
your,
I'm
your,
saying?
your, your mic is booming, by the way, too. Oh,
Yeah.
somebody said rocking with the rose gold hair.
Yeah, I still got to. I got to do my roots a little bit more. So I'll get
Yeah.
there.
Well, at least you got hair to dye. So, anyways, let's move on here, man. Unfortunately, to these numbers here, I'll go over them. Confirmed cases. This was updated, I think, at 5 p.m. Or this is last. This one right here. Confirmed cases 187,327. Wow. Hospitalizations 11,841. Deaths 2,967. Percentage of deaths confirmed cases 1.6%. Total tests 3,197. When we look over here at this slide, and when we talk about, people always want to know from yesterday to today, and so I'll just put that out there. So the increase in cases in the state of Washington, 2,923. Another 145 people in the hospital, or hospitalizations, you have 145 deaths, 26. So, coronavirus throughout the state of Washington, I guess whether people believe or don't believe, this is what the numbers are putting out there. And the numbers just keep increasing. And also, hospitalizations, I mean, the capacity in the hospitals, we're reaching a point where the hospitals are man, we're gonna run out of space soon. Basically, I don't even need to get technical with it. You know what I'm saying?
Yeah, I read something the other day, and it's talking about the overall the United States, their average age of death might actually lower overall because of these hospitals being filled, and that's because people that have either minor gunshot wounds, maybe a stroke, maybe a heart attack, there's no beds for them available, and they're not being able to be served because of the overinflation of the amount of people getting service for coronavirus, that they can't just treat simple, like easy modern medicine can easily fix these problems. And so people might actually die from common things that the hospital could help, but since their beds are so full, they just can't service the everything else.
Yeah, no, this is true. All right, so let's do this. We've got Kevin back there in the green room. Hey, what's up, Kevin? Let's see you back there. And so we're gonna bring on Kevin, and then we're gonna talk to him in this connection here with MMR. And then after Kevin, we've got a short video segment. You and Jake Gravbrot went and got a coronavirus test 2 days ago, and so we'll follow up with that. And 1 second here, Kevin
Hey.
Schofield, welcome to
Hey,
the
guys.
Coronavirus Update Show.
Amari, Bobby, loving the
going?
hair. I'm loving
Thank
the
you,
hair.
Kevin.
And you're just lucky you still have hair. And I'm with Amari on this, right? It's like,
This
no, man.
is what I'm saying.
I can grow
When I
up
was your
here.
age, when I was your age, everyone was like, "Man, because I like had big, thick hair. It was like you're gonna have hair. You don't ever have to worry about going bald." It's like, boy, was that wrong. So enjoy it while you still have it.
You still got a few strands that could be dyed over there, though, Kevin. Bobby got the
Yeah, I can go for the Rudy Giuliani look. Have it, the hair dye dripping down the sides.
They're the best. Okay, so Kevin, you came on the Morning Update show maybe a week or 2 weeks ago, and you talked about some research that's out there, the links between the MMR vaccine that a lot of people in the U.S. under the age of 50 or younger might have gotten vaccinated against MMR. And you also talked about a link about how that vaccination somehow might play a part in combating COVID. I don't want to put the words in your mouth. You're the wordy and nerdy guy. You're good at explaining things, so the floor is yours.
Oh, thanks. Yeah. So, there's been these puzzles around COVID, right? Like, why do older people get more severe cases than younger people? And why do some countries have really low mortality rates from it, and other countries, sometimes even like right next door, have much higher ones? And the research community really has had a hard time figuring what this is. There was a theory that was floating around back in the spring. Somebody kind of looking really closely at this said, that could be the MMR vaccine, the measles, mumps, rubella. I know, easy for me to say. Vaccine that, we give out, automatically to kids. Now there's actually sort of two doses. You get one dose when you're about 1 and one dose when you're about 4 or 5. That protects you from these three diseases. And so back in the spring, some scientists said, it looks like there might be a pattern there. And then, and it lined up with a lot of really interesting things, like, some of the countries that had really, really low COVID mortality rates had just very recently done big vaccination campaigns, like Hong Kong. Hong Kong did a major MMR vaccination campaign in '97, and then just last year, 2019, they did one for first responders and medical workers and things like that. And they've had super, super low mortality rate for this, right? And there are episodes like, you remember the USS Roosevelt, right? The Navy ship that had an outbreak of like 1,100 sailors last spring. They had like 6 fatalities from it.
Didn't the captain of that ship lose his job because of that?
He did, though. I think he got it back. But
yeah, because
he
they
sounded
fought for him.
alarmed.
I mean, they really fought for him.
Yeah,
I
they
really
did.
liked. I really found that boggled my mind when that happened.
I was
How
heartened by that
possible these
too.
kids- Yeah.
Yeah. So they had like 1,100 cases on the ship and very, very few fatalities. Well, it turns out that the military revaccinates everybody with MMR when they enlist, right? So all the young sailors on that ship had just recently been vaccinated with MMR, right? So it's an interesting hypothesis. So just about 3 weeks ago, a new research paper came out from a different research group that went and said, okay, let's take a look at this. So they found a bunch of people who had tested positive for COVID, and they kind of split them up into, here are the people who have had the MMR vaccine, and here are the people who have not. And so with the people who have had the MMR vaccine, they said, let's figure out sort of how much, because if you're, the kind of immunity that you get from a vaccine fades with time, right? Your body, how a vaccine works is you basically inject some DNA into your body or RNA, and your body learns to spot it, right? And the DNA or RNA is part of the virus, right? Your body, it sort of kickstarts your immune system to train up and learn how to recognize things, evil viruses and things, so that you can respond really quickly to it and sort of smash it down really quickly. So they said, okay, let's see how much of that MMR immunity these folks still have in their body. So they went to see like how many mumps antibodies do they folks still have in their body, and they found out that the more mumps antibodies, which is kind of a proxy for how strong is that MMR vaccine still in their body, the more mumps antibodies they had, the less severe symptoms they had to COVID, right? And then they looked at the other group, and some of them had mumps antibodies because they'd been exposed to mumps at some point in their life. But there was no correlation at all between the level of mumps antibodies they had and how severe their symptoms of COVID were, right? So we got this group of people, and it looks very clearly like if you had the MMR vaccine, it gives you some kind of protection against COVID, right? If you had it more recently, it seemed like it was, almost gave you immunity to it. And if it was longer ago, you still had, much less severe symptoms. So like, wow. Now, there's some really important caveats we have to remember about this, right? One is this is one study, okay? And rule number one of science is it's not science until you can repeat it. Right?
Kevin, who conducted this study?
I'll have to look that up again. Let me see if I can find it real quick here. That study was done by, it was a coalition of researchers across a whole bunch of different universities: School of Medicine, Tulane University, Louisiana State, Brown University, some folks from Turkey, Nevada Spine Center in Los Angeles.
So this is a study that's been done around the world. I noticed in your article they were talking about, the Chinese, that they had done some testing over there, and they'd found out that 1997 is when they started making the Chinese children in school get vaccinated and stuff. So
yeah, I think noticed. Yeah. So that particular new study that was done was sort of an international coalition, and they sort of pooled data from a bunch of different places together, which is great. You don't want that sort of all to come from just one country. You want to be able to sort of spread that around the world to make sure you're not sort of introducing biases into the data sets by just sort of limiting a geographic area. But it still needs to get repeated. The other thing to remember about this is that there is not before everybody runs out to try to get an MMR vaccine, right? While they do give it to young adults, there's less data on how well the vaccine is tolerated by older adults, because it was a vaccine that was really designed and tested with kids. But I mean, one thing we want to keep, so we should not all necessarily run out and go get MMR vaccine. There also just isn't enough.
I'll be honest with you, Kevin.
Yeah.
A lot of people in my community wasn't planning on running out and getting no vaccine anyway. It's just.
No, I understand.
I mean, a lot of the African American community, man, real skeptical about the vaccine. We've been having lots of conversations about that. So I know that they're not going to go and run out and go get the.
And there's particularly with the Trump administration, there's really good questions to be asked around: is it tested well? Right? Did they skip steps? Did they, when they rushed this through, and they have rushed it through, did they still do it right? We should all be asking those questions and that. And, that's something I'm going to be looking at. And, the other weird thing about sort of talking about the MMR vaccine is this is the vaccine that the anti-vaxxers, the ones who say, hey, vaccines cause autism, this is the one that they've targeted, right? And it was based on this literally fraudulent study by a guy named Andrew Wakefield in the UK. Right. And talk about science. That is the thing where they could not repeat it. He came out and said, sorry, go ahead.
Jump in here real quick, because it looks like some of the viewers are confused. Sue Fox, so if you have mumps antibodies as a result of having mumps, no apparent protection from coronavirus. But if you got MMR vaccine, there is. Did I understand that right?
Sue, you got that exactly right. There seems to be something in the vaccine that's conferring resistance that wasn't about getting mumps. And they don't know what it is yet. right? There's a lot of studies, but I mean, there's lots of interesting, data that comes out of this. One part of this, hey, somebody who had the MMR vaccine 40 years ago still has immunity to this. That says, hey, that's a great sign, because one of the outstanding questions for COVID vaccines right now is, how long is it going to give us immunity for? Is it going to be like the flu shot where you have to get a new one every year? Or is this something that lasts for 40 years? And now we have some evidence that you could actually have, some level of protection against COVID for 40 years, right? So that's a good sign. They need to figure out what it is that was in that vaccine. What chunk of DNA was it that helped train up people's bodies to give them protection? Yeah, you're right, Sue. It's super weird, and there's a lot of more research that needs to be done on this. But it's a really important result. And just another really important thing. Because we've all been under COVID lockdowns and things, there are a lot of kids who are behind on their vaccinations this year. Right. This is a really good time to double check to make sure your kids have the vaccinations that they need. The MMR vaccine was introduced in 1971. It's been around for a long time. It is super, super safe. And that doesn't mean no one will ever have a bad reaction to it, because there's always a tiny number of people that have a bad reaction to a vaccine for, whatever reason. But it has been thoroughly, thoroughly tested, and it's super safe. So if your kids are not up to date on their MMR vaccine, there's a great time to go get that vaccination.
Speaking of vaccine, then, so it's a few things. Is that, because it's interesting, we have this conversation. It's a lot of people who aren't really for the vaccine for a lot of different reasons. So you got a lot of black people who history is proven, you know what I'm saying? It's been medically experimented against black people, you know what I'm saying? So they have a caution about it. Then you got some people who are like, man, this is crazy. A vaccination might take 8 years, some of them 20 years to put together. And now we're talking about, less than a few months. Then you got other people along political lines. Well, man, you know what? I just don't trust Trump. So, you know what I'm saying, I'm not going to take a vaccination and some of everything else. It's a lot of different orbits that are out there around people as far as vaccines. But to hear you tell it, most Americans have already, taken a vaccine at one point. The majority of young Americans, because to get into Seattle public schools, you have to show a vaccination record. And so there's so many people who have taken vaccines, and it has been forced. When you think about it, I'm just off the top of my head, if you're going to put your kid in school, what's your option? Homeschool or go get vaccination?
Yeah, well, that's what I was also going to ask is it's still federal law that to have children in a public school and or a private school, they have to be vaccinated, correct?
I think it's state law.
It's state law.
Yeah. Okay. Yeah. There's state requirements for that.
Are you going to take a vaccination, Kevin?
I will absolutely eventually. I will absolutely eventually.
Kevin.
No, I'm just sorry.
Mike.
So Mike right here. So I apologize. So I don't know if you guys can tell from the video, just a little bit about me. I was born with a cleft palate, and so I have a little bit of a speech impediment. And so particularly when I'm talking fast and stumbling, I channel my inner Joe Biden and try to not stumble over my words. So I fully intend to get a vaccination. I'm reading, the FDA just put out their report on the Pfizer vaccine, which is the first one that's going to be out. And I'm reading it through just so I can answer for myself. There's questions of were they thorough? Did they do the right things? And I used to work in a research lab for a long time. I worked at the research lab at Microsoft. And I had the privilege of working there with a couple of folks who were MDs, who were medical doctors and had PhDs in computer science, and did a lot of work on kind of new methods for designing vaccines. And in fact, some of the new methods they're using now. The way we design vaccines now is really, really different than the way they used to design vaccines. Basically, they used to basically take the virus, sort of chop off a little bit of it, and to make it hopefully killed and stick it in your body, right? Then they said, okay, we're going to do a live virus, so it could still kind of replicate a little bit, but it's not going to replicate like crazy. And that, so they can put a little bit in your body, it'll do a little bit of replication, which then just helps your body learn to fight it off a little better. Now, what they do is very, very different, right? Now, one of the issues with viruses that we see with the flu is they constantly mutate, and we're seeing this with COVID as well. COVID mutates like, I think on average like 2 mutations a month, like just like within any particular geographic area. So over, we've probably seen 20 to 25 major mutations of it here in the Seattle area just since the beginning of the year. But the funny thing about the way DNA works is that it's basically like a computer program, but there's a whole bunch of parts of that DNA that are just junk. They're just meaningless, right? They don't mean anything in there, right? So if there's a mutation in a junk place, it doesn't change anything at all. But if there's a mutation in a place that's like this really important part of the virus, then it basically kills itself off, right? Because it can't do its thing anymore, right? So it's really important when you're analyzing viruses, and this is where a lot of kind of machine learning and computer science technologies come into play, is to be able to analyze a virus and figure out what are the parts of it that are really essential and what are the parts that, if there are mutations there, it can't change. So then you can pick out the parts that are really, really essential and then design a vaccine around just them. You don't have to put the entire virus DNA into somebody's body. You can just find the really essential little parts of it and put those in. And that helps your body, because then it doesn't have to try to build immunity to the entire thing. It can just build immunity to this tiny little part.
So are you saying then that the speed that this vaccine has they've come to market with, is a lot of it's based upon new technology
Yep,
that you
that
use
is absolutely
to be able to create a vaccine? Is that what
Yep.
you're saying?
So in mid-January, China had already sequenced and published for the world publicly the DNA sequence of the coronavirus. And then instantly, Moderna and these other companies were long before, weeks before our government launched Operation Warp Speed, right? They were already designing a vaccine, right? Because they had the DNA sequence and they were looking at it and were trying to analyze, what are the pieces of this that we would extract out to design a vaccine around.
Now I know you didn't come on here to it was MMR that you came on here about, but I just want your opinion. Man, do you think that Americans are gonna take this vaccine? I mean, it just seems like hella frightening. Like, I know, I mean, there's people in my family who are like, man, I'm good. You know what I'm saying? They're absolutely, they're not going to take this vaccine. And I mean, what I hear them saying, at least in DC, is that it's not about the vaccine, it's about people being vaccinated. And so, they've got this vaccine out there. Do you think that the number of American people who they say need to be vaccinated for this thing to move on, do you think they're going to hit that number willingly, or do you think the government is going to come into play here and say, hey, you know what, you can't access this unless you've had the vaccine, you can't access that unless you've had the vaccine?
I think it'll probably be bits of both, right? I think I would be shocked if there wasn't a mandate for kids to get the vaccine before they went to school, right? I'd be shocked if that didn't end up in place. And there's lots of precedent for doing that, right? There's always going to be some set of people who have, compromised, bodies just from whatever, medical conditions they're suffering with, who just won't be able to tolerate vaccines, right? But, in the end, it's more important for the rest of us to get the vaccine to protect them, right? To cut down on just the general spread of the virus in the community, so that they can be out in the community with us without risking their own lives, right? Because they're not going to be able to get it, right? So, my hope, here's my hope. My hope is by, January, February, there'll be enough people in the country and in the world who've had the vaccine and like with a lot of vaccine, like I get the flu shot every year, and then for a day or two, I feel crap, right? I feel like crap, but then I'm fine after that. I think by January, February, there'll be, hopefully tens of millions, if not 100 million or 200 million people in the country who've actually gotten the vaccine. And we can look around and say, yeah, all right, I know all these people who've had it. They're fine.
Man,
I think this is okay, right?
It's like,
it doesn't look like an experiment when 100 million people have it, right?
yeah, I come from a family where it's like, I mean, I don't know. You know what I'm saying? Even me, I've never taken a flu shot. I think the only shot that I've ever had outside of, I guess, childhood immunizations was yellow fever because it was a requirement, in some of the places that I worked in a yellow fever. But like, I don't. It's just, this is a trillion-dollar question when you talk about our economy and some everything else. I mean, and people's stance around this vaccine is, man, it's intractable. I mean, even when we see here, even the stance. Here's what I'm saying: is that there's tens of millions of people, if not more, who are like, man, I'm not with the mask. I'm not with the, you know what I'm saying? We see here in the state of Washington. Down in Lewis County, the Spiffies, the restaurant that's making all the news here. You know what I'm saying? They're open. They're getting fined $9,600 a day. The owner was like, "That's old news, man." You know what I'm saying? Let me get back here and keep cooking. And so it's like, people's positions, whether one way or another, they're very entrenched about masks. And I just have a feeling that, even around vaccine, like I said, in my own family, my mom's like, man, she's good. She's like, man, if they won't let me on a plane, it's cool. Let's drive cross country. That's just, what I'm saying. My mom's like, yeah, I'm not getting on a plane. I'm not going to take a vaccine.
Yeah. Well, so I'm looking forward to having, a federal government that doesn't politicize this, right? I mean, we're all
real political now,
and this is and the day Trump stood up in the White House press room and said, there's a recommendation from the CDC, but I'm not going to wear a mask. It's like, great, he screwed us that day when he did this, right? Because he politicizes. The CDC is the best public health organization in the world by far, and that's ours, right? It's our country's. We have the best public health organization in the world, and we've screwed it up in the last year, right? And we've cast doubt on their ability to do good work on this, and that's not to say they're perfect, right? They're not a perfect organization, right? But they're also open and collaborative, and they publish their work, and so we can they show their work, right? So we can see what it is that they're doing on this. And I'm looking forward to having a president who doesn't politicize the CDC. We'll be better for that, right? I know, and this is going to be tough. This is the next few months as this rolls out are going to be tough, right? And I'm happy to come back on. I haven't got all the way through the FDA report on this yet, and there's going to be reports over the next few weeks as we start to roll out doses. We're going to see, I saw a random report earlier today on social media that some people were having allergic reactions. And I did not see any confirmation. It was a random social media thing. I do not know at all if it's true. I'm waiting to see, to get that kind of stuff confirmed so we can see, what's the real data on this? What's actually really happening, right? What are, the State Department of Health saying here for the people who are getting it? Is it, are people tolerating this vaccine okay? Is it still, do everybody believe it's safe? And then, we're going to see, if we do get tens of millions of doses in, and we see, what happens with specific populations, like populations in long-term care facilities and our, frontline workers in medical facilities, right? They track what the COVID infection rate is with medical workers. And we'll get to see, if they all get vaccinated, we'll get to see whether that drops to zero or not in the following weeks. Right.
All right. Kevin Schofield, we're over time, but that's to be expected with the wordy and nerdy Kevin Schofield, man.
Sorry, man, it happens every time.
I appreciate you taking the time to join us. And man, let's continue this discussion. We'll keep checking back in with you and see how these things progress. And also we'll check back in with you after you take that vaccine shot.
Absolutely.
Thank you, Kevin.
Thank you, guys.
All right, we'll be right back on the Coronavirus Update Show. There we go. Oh, I'm back already. Wow, that was quick. Let me bring this guy in. What's up, Bubby?
Hey, ran to get my charger.
Oh, okay. Well,
Yeah, I mean, I really found that, I really liked his article. He covered a lot of different areas, a lot of bases.
Deep.
Yeah,
Kevin goes deep.
It was.
I'm sorry. Go ahead, Bubby.
No, I was just gonna say that he covered a lot of different sections that has to do with it's the history of the MMR shot, the connection of the numbers from around the world, and then locally and nationally about some of the people's feelings on getting vaccinated. So I think you brought up a good topic that is vaccinations.
It's science. I mean, you got a science argument, you got a political argument. You just got to be realistic. You know what I'm saying? I mean, that's why when people are like, oh, someone is against vaccine, they must be a Trumper. And it's like, nah, not exactly. Or somebody is for the vaccine, they must be, a Biden or whatever, man. I mean, this has got all kinds of deep-seated, things in it, man. I mean, just like I said, the speed to market. There's a lot of people who just don't trust that. You know what I'm saying? Not even on the political side. It's like, man, this thing's coming to market too fast. They put so much money in it, you know what I'm saying, and develop it, is it all good? And then, like I said, then there's go ahead.
Which is a good point. I mean, that's a really, really good question. I mean, like, I don't think I'm going to be around. Like, I don't think I'm going to get the vaccination, probably for almost another year, because everybody, when they do get the vaccinations here, it's going to be to the most vulnerable people, the frontline workers, the older people.
Person, it's not going to be till later next year anyway.
Yeah, and so I think all the testing might be hashed out there, and I don't want to get too deep into it, but I think this is going to coincide with the universal health care. Once there's a little bit of normalization about going to see the doctor, and because there's a lot of people that they won't even go see the doctor. You know what I'm saying? So they won't wear a mask. They don't get, don't get COVID tested. They don't, so what makes you think they're going to get a vaccination? It's not even that they're scared of a vaccination. They don't want it. They don't go to the doctor. They don't visit the doctor, but it is what it is.
One thing that we can all agree on, right? One thing, hopefully, we can all agree on, people watching here and the general public, people don't want to agree on mask. People don't want to agree on vaccine. But I think one thing people can agree on is, man, get a test. You know what I'm saying? And speaking of getting a test, so Jake grabbed Brian, yourself, Mr. Bobby Stills. You guys went for a test the other day, right?
Yeah. So, I get tested almost every other week because, I am out working with the public a lot of times. And, I do come into the office to work with you. I want to keep everybody safe. It's kind of hard because it incubates for 14 days. So I have to keep up on my shots. There's a lot of different places, and I'm sure Nikki has posted on our sites about some of the free stuff. We're going to be covering some of the free testing. Yeah, they're going to be covered. The mayor's going to be rolling out the kiosks and stuff like that. I think 55.
Two of them are out right now. Yeah.
Yeah. So we'll be checking in with some of the people that run those kiosks and stuff. So there's not really an excuse to do it. But Jake Gravbot had to go see his father in Phoenix. He hasn't seen him for a while, so he had to go get a test. And so I told him that I'd accompany with him to go get a test. And you're about to see what ensued.
Fight!
Yeah, for sure. Jake won, bro. I
No,
mean, you're
What's
You
the
making all these
criteria?
faces.
What is the criteria for winning? I did it
Man.
faster. I didn't have to take a break in between.
That's because they saw you wincing and they were just trying to hurry up and finish. You know what
No
I'm
way,
saying?
man. Well, I've also had it done more times than he has. You know, I'm more a seasoned vet when it comes to testing. We're gonna let the public judge on that when we put the video up. You know, there's lots of criteria to judging. You know, you may call the Tyson Jones fight different than I did. You know.
But I'm just saying, man. But I mean, one thing for sure, there's lots of free testing that's out there. It's people's stance around COVID. Like I said, it's definitely wide and varying. But we want to encourage everybody, get tested, especially the city of Seattle, man. There's so much free testing that's out there. A lot of it's walk up, and the results. You guys got your results the next day.
Yeah, within 24 hours. You don't have to go and get them. They can call you, and that's kind of why I wanted to make that little fun video. Was like, that's literally how quick it is. I waited. Oh, that's not true. It's whatever. Early voting or early polls. Yeah, it's that we waited in line for
You
probably
got
for
a
about
sympathy vote.
yeah, right. We waited for about 15 minutes, and we sat down. And it was quick. It wasn't that fast. We got our results fast, and I think testing needs to continue to happen. Just because vaccinations aren't coming out, we still need to keep getting people tested. So
Yeah, no, for sure. All right, well, look, that's it for us for today for the coronavirus update show. You know what I'm saying? Thank you, Bobby Stills, for filling in. I mean, the postman's always delivering one way or another, man. You know what I'm saying? I can always count on you to come through. I'm back tomorrow at 11 a.m. for the morning update show. If you watched today, you probably saw that red hair back there in the other studio where we were shooting the morning update show. Coronavirus update show returns Monday at 6:15 p.m. And until then, peace.